painkillers, and if you're someone who's actually been taking painkillers, you will know is kind of linked to your own mental health, because you're experiencing that pain. If it's a constant pain, then you know you need that quick relief.
Yeah, exactly. Well, we have stats that shows that people who prescribe to pain relievers, they often misuse them. But anyways, on today's show, it's about good vibes lah, bro. Huh? So now, coming back to pain relievers, painkillers, how can it actually be something good for you and me? It's time to find out. Terence,
We're not going to have this conversation without the risks involved, so let's talk to our expert on the show. We have SITI NURSYAHIRAH, who is a pharmacist with AMPANG Hospital. Thank you for joining us.
Thank you.
And let's give a quick definition. I know definition of words these days, even Supreme Court Justice nominees sometimes can't do that, but we need to do that. Let's define painkillers.
All right. Okay, first of all, good morning. Thank you for having me here.
Morning, doctor.
All right. Okay, so back to the question just now. What is painkiller, right? Okay, so pain is actually something that we take to treat pain. All right, painkiller, or what we call as analgesics. All right, in the market there are a lot of brands, a lot of types of medications. Okay, there are also so many dosage forms. For example, patients can take in the form of tablet, capsules, syrups, injection, even suppositories, medication that you put into your rectum. All right, so many types. Anyways, I will start off by maybe giving a little bit overview on what painkiller, what pain is.
Yes, please
All right.
do.
Okay, so what's the definition of pain? All right. So pain is whatever that you feel uncomfortable, unpleasant experience or sensation. Okay. So there are two main types of pain. First is acute pain, and the second one is chronic pain. So what is acute and chronic? Any idea?
Oh, okay.
Chronic, I would say, is more long term.
Yes.
Would that kind of fit in the definition of chronic?
Sure, all right. So acute pain basically is something that's painful, but it comes and goes away very quickly.
Right.
For example, toothache or maybe headache. Maybe you can have it for what, 1 or 2 days or a few hours, and you take paracetamol and then it's gone. Okay, so for chronic pain, it's actually a type of pain that it lasts longer, sometimes even up for months or years. And sometimes when you have chronic pain, even though you have removed the cause of the pain, you treated the pain, but you can still feel the pain. All right? So all these type of pains can actually be elevated, and you can treat the pain by taking painkillers.
Right.
However, I believe that many people feel like, oh, taking painkillers are not good. But actually, if you take it the correct dose, under the supervision of doctors and pharmacists, you take it for the shortest amount of time, is actually more beneficial than risk.
Just like the usage of opioids, where they have the program for people out there so that they won't actually misuse them in a way, or come up with excuses just to use opioids and consume opioids. Correct, doctors?
Yep.
So, like what Terence said, so it can be a mental thing at the end of the day. After getting your painkillers or pain relievers sorted out for you, it can sort of like affect your mental, maybe, perhaps.
Because sometimes when you are always in constant pain, you will feel stressed. Your body will feel stressed. So sometimes when you take it, then you will feel good. So over time, when you take it every day, and somehow you will develop some sort of dependence on it. So if you don't take it, it might be, your body will be like, oh, I'm groggy today. Even though you are not really in pain, but actually it's because of you are getting more dependent to the medications.
Just like how if you don't consume coffee in the morning and then
Yes.
your whole day is like ruined in that way.
Maybe that's a different thing altogether, but pain itself, I can tell you as someone who had chronic pain for a good period of time, it's something that is constantly on your mind, even when you wake up in the morning. So the first thing in the morning you feel when you wake up with chronic pain is, how am I doing today? Am I okay? Is it bad? Is it good? And then when the pain hits you, you go, oh, I'm not okay. So I need to reach for that painkiller medication, the prescription that I've been given. But how is it that pharmacists and doctors can tell how intense your pain is and how they would go about prescribing the right medication?
All right. So basically for painkillers, usually doctors will assess pain by asking the patient. Actually, there is this scale from 0 to 10. The patient can only tell how painful it is. So you can tell, oh, maybe my scale is 10. So the doctors will know, okay, this is a very strong and severe pain. Then the doctor will assess what are the causes and what are the factors. So before starting painkillers, they actually need to go through some list of things to take into consideration before actually prescribing patients with painkillers.
So what I went through was chronic, long-term, but it was for a period of time, 6 months to 8 months. But some people go through this condition for their whole life. I'm going to cite sufferers of endometriosis, for example, among the women who go through a painful cycle every single month. So with those kind of situations, what really are the risk factors of taking painkillers long-term for the rest of your life?
All right, so some of the risk factors of taking painkillers for a long period of time. Actually, before I explain more on that, I'm just going to explain a bit on type and categories of painkillers. So we have 3 main types. So the first one is paracetamol. I'm pretty sure you've heard of it.
Yes.
Yes.
That's a painkiller? I thought that was just a fever medication.
Yes, that is also
self-prescribed.
true.
And every single thing that comes along with it.
Must have paracetamol.
Yeah.
Right. Okay, so paracetamol, or what we call as acetaminophen, is actually a very safe medication. So it's also mostly used, most common over-the-counter medication.
Yeah.
All right. So I'm pretty sure everybody must have taken at least once in their life, right? Okay. So for paracetamol, it's a very safe medication, like I've mentioned. So the risk is a bit less as compared to the other 2 categories. Okay. So I'll just explain. Number 2 is actually non-steroidal anti-inflammatory drug. It's a long name.
Yeah.
Right.
I'm just going to put it as NSAID.
Okay.
Or
And
NSAID for
NSAID,
short.
okay.
All right. So the other one we have is opioid. Well, that's the one that you've mentioned just now. It has higher risk of dependence, tolerance, and even if you quit taking it abruptly, then you will have withdrawal syndrome.
Yeah.
Yep. So yeah.
So paracetamol, the one that we know, fit into the first category. The second category, I think, is the one most people use. Your Voltrons, your
Yep.
Coxia, that possibly
Constant.
fits into that category.
Yep.
So what are the risks of that category? Because I think opioids, as Brandon mentioned, is probably something that's a really last resort.
Yep.
And not
It's very
everyone,
strong.
not everyone gets to that level.
Yeah.
So let's deal with this middle category where it's also available off the counter. You can go to a pharmacy and get it.
Yes. So for NSAID, non-steroidal anti-inflammatory drug. So a bit background on what NSAID is. So it's a type of medication that helps treat pain, mild to moderate pain. However, it's somehow better than paracetamol in a way that it can help to reduce inflammation, as the name suggests, anti-inflammatory. So actually, most types of pain, for example, muscle pain, back pain, sometimes it comes with inflammation. All right. So, for example, swelling, redness, irritation, heat, and those things. So when people take it for a long period of time, there are more risks than paracetamol. Okay. What are the risks? For example, for patients that have like previous history of asthma, stomach bleeding, ulcer, as well as heart problems, it's very, somehow they have to be extra cautious when taking NSAID. All right. For example, like you've mentioned, Celebrex, mefenamic acid, ibuprofen, diclofenac. So actually, it's best for patients to actually take NSAIDs under the supervision and advice of pharmacists, because somehow if you take it over a long period of time with other medications, it could probably give a more prominent side effects such as stomach bleeding and others.
You know, I have to say, because I only use paracetamol and, you know, the other types of pain relievers I don't really use. So in terms of addiction, I don't quite understand and I don't quite know. Well, people out there, they might not know that the pain relievers can actually be very addictive, but at the end of the day, it can. So enough said. Now, actually, how can people out there understand what painkillers are and how does it actually work so that if anything happens, they know where to draw the line?
All right, okay. So for the 3 types of medications that I've mentioned, paracetamol, NSAID, as well as opioid. So paracetamol is actually, we don't really know exactly the mechanism of action. However, it is thought that it blocks this one type of enzyme called cyclooxygenase enzyme. I'm going to call it short as COX enzyme.
Okay.
All right. So the NSAID It also works by inhibiting the enzyme, COX enzyme. Okay, so we need to know what does COX enzyme do. So it helps our cells in the body to produce a hormone called prostaglandin. Okay, the prostaglandin is the one always associated with pain and inflammation. So when there is more prostaglandin, there will be more pain and inflammation. So what NSAIDs do is that it helps to reduce prostaglandin and reduce pain and inflammation.
But it does not cure the condition that causes the pain. So the condition is still going to be there.
Yeah, but when you block the enzyme, you will reduce prostaglandin. It's always associated with pain, so you will feel
less pain.
relief. Yeah.
So that's, I think, also something very important, because you may not feel the pain, but the underlying condition might still be there. Once again, I'll use myself as an example. I had a small tear in my shoulder, and this tear did not heal because I took painkillers. The healing was ongoing, and it was causing pain. So I think a lot of us need to also understand that it's good to go in for a follow-up checkup, because today your pharmacy may recommend X dosage, but maybe 3 months down the road, it might change.
True, because sometimes the best advice is to actually get your doctor to assess, especially when the doctors start with something as simple as paracetamol. Then we will see, maybe in 2-3 months' time, if the pain is still there, still persists, maybe you need something stronger, maybe you need a higher dose, maybe you need a different medication, or maybe altogether you have other underlying causes. Maybe something that we cannot catch in the first time.
Okay, so what is the usual length of this treatment, perhaps? You know, sometimes we, like you said, we have to understand first what is the problem. So maybe the problem is there, a chronic problem, chronic issue with your body or whatsoever, and maybe we don't even need something that is actually so strong as compared to what a doctor prescribed for you. So will the pharmacists actually assist people out there and give them some advice also as well to actually tell them how long usually this treatment would actually take?
All right. So it's pretty simple for painkillers. You take it when you need it. No pain, then you don't have to take. But sometimes doctors do prescribe, say, for 3 days, 1 week, so even for months. But then usually what we suggest is that for the first few days, when you have that pain, please do take. For example, paracetamol, maximum dose is 4 grams per day. 2 tablets, 1 gram 4 times daily, every 6 hours. So maximum dose is 4 grams per day. Please take when you need it, and please do not exceed the maximum dosage allowed per day, which is 4 grams.
Oh, okay.
So when you feel pain, take 2 tablets, another 6 hours. Oh, still pain, then you can take 2. But do not take it like, oh, every 2 hours take until it exceeds 4 grams.
So it's like paracetamol that we cannot take more than 4 grams a day. But let's say if it's really painful, we are definitely, you know, in for something which is actually much stronger. So how does this actually make sense? Because paracetamol, you cannot take more than 4.
So basically when you take 2 tablets 4 times daily for 2 or 3 days, but still the pain does not go away, maybe you can take something stronger. But in order for you to take something stronger, maybe you can, it's best for doctors to assess what type of pain is this, does paracetamol help, does NSAID help, and even doctors can't simply prescribe any type of medications for you. They have to assess the risk, some factors. How old are you? Are you breastfeeding? Do you have any other conditions, heart or asthma and things like that?
So that's very important. I think a lot of us self-diagnose using Google. How dangerous is that?
And then we scare ourselves.
Oh my God, I'm having
unnecessarily.
Because I don't think it's fair for you to just rely on Google and then blame Google afterwards for any underlying conditions that might take place. Where can people go to really get more information on the medication they're currently taking and perhaps understand a little bit more about how long they should be on the medication and what they can do to slowly maybe reduce dependency?
All right. So actually, the patients can always ask any pharmacist or any doctors, or even you can call National Pharmacy Call Center. All right, we have it. So at 1-800-886722, 8 to 5, every day, Monday, Friday, except on public holiday.
So these resources are available to you. I mean, you should use them. And I know it's kind of easier, maybe a little bit more private, you might feel, to Google. We all do that, and there's no shame in that. But at the end of the day, realizing that there is actual professional care available is more important, and it will help you take better care of yourself.
Yes, exactly. Just don't scare yourself unnecessarily. Just don't Google. If you want to Google, you're more than welcome to Google. But yeah, whatever that you get from Google, just take it to your doctors and take it to your pharmacists. Talk to them about this. If you have some really tough time with your body or what, you're having some chronic pain and all this kind of stuff, well, it's not entirely bad altogether because we have some treatments for you guys as well. So yeah, could you just share with the people at home if they have something that's really uncomfortable, you know, if they are prescribing to painkillers that is probably, maybe, unnecessary treatment program that they're actually prescribing right now, maybe you can send them some advice and to tell them what to actually do.
All right. Okay, so actually for patients, they need to know that you can't simply take medications. Just because you can buy it online, it does not mean that's the best for you.
Right.
There are a lot of factors that doctors actually need to take into consideration, like I've said just now, age, other underlying medications that the patient is on, breastfeeding, pregnancy,
Right.
allergies. So it's best to take, you can take paracetamol first. As if the pain still persists, it doesn't go away. So maybe the best for you to see a doctor and, you know, they can assess properly what conditions that you might have. Maybe, let's say, physio can help. In addition to the painkillers.
Right.
So, and also remember not to take more than the maximum dosage allowed per day. So how do you know that? Of course, you have to ask your pharmacist as well as doctors.
Thank you so
All
much.
right,
for
that's
that advice,
awesome.
yeah.
I also think that it's important to understand pain is kind of good sometimes because it teaches you that you need to slow down. I mean, this is of course for people who are in athletics and you're pushing your body. Pain will tell you that you need to slow down. So I know the alpha athlete amongst you may just take the painkiller and keep doing what you're doing,
Yeah.
but that might actually cause more damage than you can foresee.
Right.
Take it from someone who's been there.
So the best kind of pain relievers is, I would say, rest.
Rest, ice, compression, elevation. Thank you very much once again for being here on the program and sharing with us about painkillers. And I know that that's going to be beneficial to a lot of people out there.